All right, hey everybody. Let's see. Getting live. All right, going live right now. I didn't even post about it this time. I was supposed to go live on Friday. Things got a little mixed up, and I was a little busy, so I didn't get a chance to get around to it. So I'm doing it today. All right, so I'm going to talk about how everything went post my last surgery, which was 12 days ago, and I feel really good. There's still some pain, like on my side and kind of where they did it. They did do it laparoscopic this time, so that was better. But it also was, how do you say it? It was a little harder. You know, there was a lot more pain after the surgery. But what I want to talk about first is, the computer died. Okay, what I want to talk about first is, we talked about it last time, I believe, that I was going to be able to have somebody with me. That all changed again. So I did end up going into the hospital by myself, and everything happened pretty much like the first one. I just got dropped off. We still weren't allowed visitors. Well, we were allowed visitors like from a certain time to a certain time. What was it, like from 2 to 6? We're allowed to have a visitor. It was one designated visitor, but the way it happened with this last surgery was, so we went in. They went in laparoscopic, and when I got out of surgery, it how do you say it? I really something on my side. It really made it hard to breathe. I don't know how exactly what exactly happened, but it just, every time I laid down, it was really hard to breathe. And then, so the surgery lasted a good amount of time. So there was no point in my mom coming. She was my one person that was going to be a visitor. But it was already getting later on in the day. And she just, she decided not to come, which was better because there was really no point in her coming if she was only going to be there for like half an hour. And then, what happens is they really want you to start walking and moving around. So I know that, so I was already trying to walk around, and I felt better sitting up in the chair than I did laying down on the bed. So I made sure that I was sitting up as much as possible. I still, for some reason, I kept throwing up after, which I wasn't nauseous or anything. I felt like I needed to get all that probably anesthesia stuff out of me, because I don't know if anybody's had surgery, you would know, it's a weird feeling. And the next morning, I basically stayed up most of the night because I really couldn't sleep because of it really hurt. It felt like I was getting stabbed every time I would breathe when I was laying down. So, and I would just take really short breaths. It still feels a little funny, but sometimes, things just happen a certain way. I don't know why exactly that happened, but that's just the way things happen sometimes. And the next morning, I was just asking the doctors, can I go home? Since they didn't open me up, really. In my previous surgeries, I was just asking them, can I go home? Every doctor that came in, because for myself, I see 2 different teams of doctors. I have to see the transplant team because I'm a transplant patient, and I have to see the cancer surgery team. So both of these teams need to be the ones who approve for me to go home. So I guess it's just kind of experience. I was already bugging them, can I go home? One of the doctors yeah, we'll see how you're doing. And that's I was telling everybody when I would see them, and they were pretty much open to it. I did have a little draining pouch that was down here by my side where it was draining the excess blood, and the one lady from the surgery team, she had to come in and take it out. Which a crazy little story was, usually when they do that, you have to lay down, and they do it, but because I was in so much pain, every time I would lay down and try to breathe, I was like, can I just stand up and you do it? And she's like, yeah, I guess, but you just can't move because, you can't move, you got to make sure you stay still while they pull out that. It's like a long tube. It's probably longer than this, pretty long. And it's just in you, and it's connected to like a little pouch where it fills up with blood. And, the lady, pulled it out while I was just standing up, which was the first time that's something like that's happened. But it wasn't so bad. I felt better after when that thing was finally out of me. Just like with everything, like I still have like a big bruise on me from one of the IVs. I had an IV here, had an IV here, had an IV here. I had a catheter, of course, because you need one of those when you have surgery. And then I have that drainage thing, and you're just connected to so many things that every time you're when one thing comes out, another thing comes out, it just feels so much better. Like you just feel more, you're free again. That's how I feel. Let's see. But overall, the surgery, this surgery, I won't lie, it really hurt. After like the next couple of days, next 3 days, I was in a lot more pain having the laparoscopic surgery than I was when I had them open up my stomach for the last surgery. But it's a different, the pain level was worse for this one, but the healing process is better because they're not as you're not worried about your stomach opening back up, or your chest, depending on what kind of surgery you're having. So there's good and bad. Every surgery I've counted, it's 9. They've all been different. They're always different. Nothing's ever the same. They're going into your body, and they're working on things, and they're changing. They're moving things around. They're changing things, and it's never exactly the same. You never have the exact same feeling. At least for me. Let's see. So I want to talk about just so the difference from this surgery compared to my last one. A lot of the COVID stuff was still the same. There were more people in the hospital, of course. Like the last time, it was really quick after, when COVID really hit. And this time there was a lot more people around, a lot more, surgeries happening. Still not a lot, but there's more. The process was more back to normal. So last time, the first, the surgery in April, I didn't really have a pre-op appointment like I did this last time. I had a pre-op appointment again, and at pre-op they do, you do blood tests, you do. They tell you what stuff to do. They give you these sanitizers that you're supposed to use on your body the night before, and they kind of just go over everything with you, so the team knows what's everything that they think they need to know. For me, because of my heart condition, they did an EKG, and so I know some people do X-rays and stuff. But it's just more back to normal, which was good. It doesn't matter to me really. Let's see. And then I'll talk about real quick these surgeries. They're just a difference in them. This last one was rough. It was rough, but I really feel a lot better quicker, with the healing process. And then with the one before, which was in April, I feel mean, it was rough, but I really don't think these surgeries are that hard on me. Like the last surgery that was really hard was the last open heart surgery, where they replaced my tricuspid valve, and those surgeries are more of what I've had done. I had an LVAD a long time ago. 2 times the LVAD has malfunctioned, and they had to go in and repair it. Which I showed the LVAD last time, and then I had my transplant, and then a couple years later, I had a year later after my transplant, I had my gallbladder taken out. I think like 3-4 years after that, I had a sinus surgery, and then I had the sinus surgery. Oh, and then I had the tricuspid valve. Then I had the cancer surgery and the last cancer surgery. And every time it's always a difference. There's always a different, recovery. And, it's sad to say, you just get used to it. I go in with positive, and I kind of just feel that I'm going to be okay. I have, a lot of faith in my doctors. I have faith in the Lord. I have faith in myself that I'm strong enough to, to withstand everything. And it's just worked for me that way. Let's see. If you have any questions about the surgeries, or if anybody's had surgeries, I know recently I've been getting a lot of people have been reaching out, let me know what they think about the videos and thank you. And if you have any questions, or anybody else that's going through, I know a couple people that are going through cancer also right now, that have reached out to me and told me, or if you're going through any kind of, medical condition or just personal stuff, if you want to reach out, let me know. I'm always open to talk to anybody. So on Friday, I wanted to do this video Friday. I ended up I went to the hospital, I got my results, and everything came out good. Everything was basically the same. So it's a slow moving cancer, and it was all basically encapsulated. So from what the doctors are saying, they got everything. I'm supposedly cancer free right now, and they're going to go back in a couple months and do another CT scan to check me. But it's weird. It's really weird, like, getting that news. I didn't for some reason I just wasn't ready to talk about it. I thought I really wanted to talk about it on Friday, like beforehand. I was like, I'll talk about it Friday, and just, we'll go from there. And I just wasn't ready, to talk about it yet, to do the video like I'm doing today. And it's a weird thing. Like, I went in very positive, and I don't really have too much emotion about it. I don't really have too much emotion about, like, of course I understand it's great news, and I'm super blessed that everything has worked out good, but I really haven't, I don't know if it hasn't just like hit me yet, but I just don't feel like I really care either way. Like, I feel like it was going to always be this outcome. So maybe that's why I'm not too, like, overjoyed about it, or it didn't really affect my mood at all. But it did, I guess it did affect me a little bit, because I didn't want to do a video. So I don't know, but that's just where I'm at right now. Thankfully everything has worked out. I know when I told my mom, she was like super excited, and of course, but I really wasn't, like, I didn't know how to take it. I guess I still don't know how to take it. And maybe it's because I just really felt already that this was going to be the outcome. And that's how I feel with the most of my health issues. I'm always gonna overcome, and I kind of come in with a more positive vibe, I guess. It's hard to describe. It's hard to put into words at times. I had this same kind of feeling when, not very different, but I had a same kind of positive feeling when I was going through my transplant years ago. And I do talk about that in the book, that, it's getting real close. It's still at the editor, and, hopefully I have a better update in the next week or two. And so, I got the book, and I'm working on some one-on-one coaching with people. A lot of it's, I'm going to talk about that later. I really wanted this video to mostly be about, the medical stuff, and I'll do another video tomorrow or Tuesday, and I'll talk about where my focus is moving towards. I don't truly feel I'm out of the woods yet with the whole cancer thing. I hope I am, but we'll have to wait and see. I do know, as a transplant patient, we're more likely to get cancer. So I know I have to, take care of myself better, and, and just, do what I have to do. So I hope everybody has a great weekend, rest of it. And thank you for being on, whoever's on. And I'll see you guys in a next day or two.